Hello, everybody. Good morning, good afternoon, good evening. Thank you very much for joining. My name is Marcelo Orias. I am a nephrologist at Yale University, and I am chair of the Regional Training Center program for the International Society of Nephrology. We're very excited about today's webinar. We have some of our regional training centers that are joining, and we've also invited potential regional training centers through the SRC programs, through the Renal Sister Center program. So we're going to go over some basic information about regional training centers, and then we're going to go to something that I think is very important, where at ISN, we want to give our regional training centers capacity building in different ways. And so I'm very excited that we have Dorothea Nish and Chris Carvalho with us, who will, at the end of the information, will join to give us some exciting information. All right. So this is a map of our current regional training centers. As you see, there are regional training centers in different continents, and this is our list. We currently have 28 centers. We incorporated centers from Latin America last year, and this year we will be calling for centers in Africa. I'll get back to that at the end of the information. Why does ISN have regional training centers? Well, you try to prioritize local training. It's similar culture, language, and conditions are maybe similar to the home setting. So things can be set up there similarly. More chances for hands-on training, much lower costs, and strengthening local and regional networks, I think, is very important. Capacity has increased considerably in recent years. I think ISN is a very strong society in that it really advocates for making nephrology centers all over the world have high-quality training and high-quality patient care. And it's also very important in building and keeping connection with the participating centers. We've had graduated SRCs that were kind of lost and former centers that formed fellows. So I think it's very important to keep everybody in which ISN has built capacity to stay within the network. We'll take some questions and answers at the end of the webinar, okay? So RTCs have a 5-year renewable term. They do progress reports after 2 years. They check in with if they're meeting their goals, and we're always finding new ways to collaborate for them to achieve their goals. And the renewal is after 5 years, depending on meeting benchmarks, which I'll show in a minute. So the main expectation is participation in all ISN programs, not just fellowships. As you see, you will have the benefit to have priority access to these programs. So please take care, try to take advantage of them, as well as participating in ISN Academy and other events. We want our centers to be nephrology-related educational centers and advocacy activities to advance kidney care throughout the region. So the benefits, as I said, priority consideration when applying for other programs, for fellowship programs, for CME programs. So please take advantage of all these, as you will have priority for funding. You will have increased visibility on a national, regional, and global scales. ISN regional training centers are advertised in the ISN website and other communicational channels. And you get a certificate of recognition. And so you can use the ISN Regional Training Center on your letterhead and other communications. And as I mentioned previously, we are going to try to help capacity building, as we will try to do today. So the benchmarks, at 5 years, regional training centers should have 5 points during these 5 years. So it's not 5 every year, it's 5 during the 5-year term. And if you host the ISN fellow, that's 0.5 points for every 3 months. So you get 2 points for a full year of fellowship. Taking part of a renal sister center, be it transplant or just general nephrology pairing, is 3 points. Hosting a CME event is 1 point. Faculty acting as educational ambassadors, 1 point. And acting as mentor in the mentorship program is another point. So as you see, it's pretty easy to keep up with these benchmarks. And as I said, at 2 years, we participate with those centers to see how they're progressing and if we can help out with any other way. So just briefly, probably you're aware of these programs. About one is the fellowship program. A fellow spends 3 to 12 months at the host center getting training. Mentorship program, mentees receive professional guidance while mentors develop coaching and leadership skills. The educational ambassadors, experts spend up to 4 weeks at the emerging center and providing guidance and hands-on training. Renal sister centers, a developing center teams up with a supporting center, and over several years, there is capacity building at the emerging center. And that can be with just general nephrology or with transplant centers. And then CME, I'm sure all of you are aware of this, is a very potent educational tool that ISN has. So as I mentioned, centers in Africa will be invited to apply for regional training centers October 1st. And we will be doing this in different continents in the different regions during the upcoming years. All right, so there's some information, and we will be sending out the slides so you'll get information on when you can apply for these different programs.